Chemistry in everyday life. Introduction. Chemical compounds have been employed for a number of useful purposes in our daily life. For example, sugar is used to sweeten tea. Soaps are used for washing and bathing purposes, etc. Besides these, a number of compounds find application in agriculture, textiles, medicines, photography, etc. The chemicals thus play a very important role in our daily life and in a number of biological processes. Drugs and medicines. Drugs are chemicals of low molecular masses whose intake by a living system has a physiological effect. If the drugs help in the treatment of diseases and reduces pain and suffering of the body, it is known as medicine. The treatment of diseases by chemical compounds is known as chemotherapy. The chemicals so used for the cure called chemotherapeutic agents. Classification of drugs. Drugs can be classified in several ways. Some of these are as follows. 1. On the basis of pharmacological effect. This classification is based on pharmacological effect of the drugs. It is useful for doctors because it provides them the whole range of drugs available for treatment of a particular type of health-related problem. For example, analgesics have pain-killing effect. Antibiotics have antimicrobial properties. Tranquilizers reduce mental stress. 2. On the basis of action on a particular biochemical process. It is based on the action of a drug on a particular biochemical process. For example, COX, cyclooxygenase. Inhibitors affect the action of enzyme cyclooxygenase, which causes inflammation and pain. 3. On the basis of chemical structure. It is based on the chemical structure of the drug. Drugs classified in this way have common structural features and often have similar pharmacological activity. For example, sulfonamides. 4. On the basis of molecular targets. The classification based on molecular targets is the most useful classification for medicinal chemists. This classification, based on the nature of target molecules, is important for medicinal chemists to understand and predict the drug-target interaction. Drug-target interaction. Drugs interact with biomolecules such as proteins, carbohydrates, lipids, and nucleic acids. These biomolecular macromolecules perform various functions in the body. For example, 1. The proteins which perform the role of biological catalyst in the body are called enzymes. 2. Proteins which are crucial to communication system in the body are called receptors. 3. Carrier proteins carry polar molecules across the cell membrane. 4. Nucleic acids have coded genetic information for the cell and lipids. 5. Carbohydrates are a structural part of the cell membrane. Types of drugs. Drugs are broadly classified into following types, depending on the purpose for which they are used. 1. Antipyretics. Chemical substances which are used to bring down the body temperature in high fevers are called antipyretics. Out of these antipyretics, aspirin has been in common use. But because of hydrolysis, it gives salicylic acid, which causes bleeding in the stomach. It should not be taken on an empty stomach. Calcium and sodium salts of aspirin are more soluble and less harmful. 2. Analgesics. 1. Non-narcotic analgesics. Aspirin and paracetamol are the familiar examples of this type of analgesics. Aspirin and paracetamol act both as antipyretics and analgesics. They give immediate relief from pain and fever. Aspirin inhibits the synthesis of prostaglandins, which stimulate inflammation in the tissue and cause pain. Aspirin is also used for prevention of heart attacks, as it has anti-blood clotting action. 2. Narcotic analgesics. In addition to the above analgesics, certain narcotic analgesics like morphine, codeine, pethidine, hydrochloride, methadone, heroin, etc. are also as analgesics. These do relieve the patient of pain, but they attack the central nervous system and produce sleep and unconsciousness. Narcotic system and produce sleep and unconsciousness. Narcotics are mostly the products obtained from opium and marijuana plants. Narcotic analgesics are mainly used for the relief of post-operative pain, cardiac pain, and pains in terminal cancer patients. 3. Antiseptics. Chemical substances which prevent the growth of microorganisms or kill them, but are not harmful to the living human tissues, are called antiseptics. Antiseptics are applied to the living tissues. These are applied to wounds, ulcers, and diseased skin surfaces. The antiseptics are usually incorporated in face powders, deodorants, breath purifiers, etc. to reduce the odors which may result from the bacterial decomposition on body or in the mouth. For example, 1. Dettol, a mixture of chloroxylenol and terpenol, is a commonly used antiseptic for wounds, cuts, diseased skin surfaces, etc. 2. Biethanol is added to soaps to impart them antiseptic properties. Such soaps are used to reduce odor due to bacterial action on the skin surface. 4. Disinfectants. Chemical substances which kill microorganisms or stop their growth but are harmful to human tissue are called disinfectants. Since these substances are harmful to human tissue, they can't be applied directly to wounds. They are used to disinfect floors, toilets, etc. For example, phenol, sulfur dioxide, etc. Chlorine in concentrations of 0.2 to 0.4 ppm is used as a disinfectant for drinking water.